Cases of hand, foot and mouth disease have reached a 3-year high in the first week of May. That's according to data from the Health Ministry. Sabrina Ng finds out what's driving the increase and how 2 major preschool chains are taking precautions to protect their students.
Checking for ulcers and making sure these little ones are washing their hands. Some local preschools are on high alert amid a recent spike in hand, foot and mouth disease, or HFMD. My First School has over 160 centres, and it says steps were taken to remain vigilant. And lessons learned from the COVID-19 pandemic have helped to improve hygiene practices at its schools, such as mandating daily temperature checks.
We continue to have regular hand washing habits in our children. We also continue to sanitize our high-touch surfaces. And of course, since COVID, right, we have also stepped up the kind of professional equipping of our centre attendants, our cleaners. They are now trained professionally in enhancing the cleaning procedures and also understanding hygiene standards.
PCF Sparkle Tots has nearly 350 preschools and is closely monitoring the health situation at its centres. It's also working with parents to ensure children who are unwell remain at home. According to the Health Ministry's weekly Infectious Diseases Bulletin, the average daily number of cases from 27 April to 3rd May was 61. All of last year and 2023, this daily average never went above 50 cases. One doctor says the increase could be due to an increasingly hot climate and virus mutations.
HFMD tends to like to spread more in the humid situation, warm and humid situation. In contrast to some of the other respiratory viruses that tend to spread more in the cold winter seasons. There can sometimes be mutations in the genetics of the virus that may introduce new strains that people haven't had immunity to it before, but that remains to be proven depending on the genomic studies done on the viruses.
Dr. Ong says adults can also be infected and the symptoms are often more severe.
That could be related to the more matured immune system that reacts more aggressively against the HFMD virus. So the symptoms may look more severe than the kids with a more immature immune system.
Ahead of the upcoming school holidays, doctors are urging parents to maintain good hand and surface hygiene and to be aware of potential symptoms like rashes with blister-like spots.